Welcome to Food, Environment and Health Channel. Today we will explore how different foods can affect your blood sugar levels. We will identify which foods to avoid to maintain a healthy lifestyle and prevent issues like diabetes and obesity. Certain types of food can cause sudden and large fluctuations in blood sugar levels. These are, of course, foods rich in carbohydrates, especially simple carbohydrates, also known as sugars. They do not require digestion and therefore rapidly transition from the intestines to the blood. Large variations in blood sugar levels further cause a strain on the pancreas, which maintains blood sugar within narrow limits by alternately secreting two hormones with opposite effects, insulin and glucagon. Large fluctuations in blood sugar and pancreatic strain over many years lead to insulin resistance, metabolic syndrome, obesity, and diabetes, as well as numerous other health consequences. Unfortunately, these often manifest very subtly and gradually, becoming noticeable only when it is already too late. Insulin resistance, stemming from improper diet, often has no symptoms. Even diabetes can have very discrete symptoms, which people might get used to and fail to notice as the disease progresses. You might be wondering if an obese person can be metabolically healthy? It is possible, especially in the case of female-type obesity, but apple-type obesity and the accumulation of fat in the central compartment is almost always associated with metabolic disorder. In the next few minutes, we will focus on the foods that cause the greatest variations in blood sugar levels. Science uses the glycemic load index for this ranking, and I will base my information on this index, even though values can slightly differ based on the recipe and the sample of people tested. Foods with higher glycemic load values cause larger fluctuations in blood sugar levels and are better avoided. Keep in mind that individual reactions may vary, and the values I will mention are relative and serve only as a guide to roughly rank foods according to how bad or good they are for weight management and overall health. Let's start with bread. 30 grams of white bread has a value between 10 and 15. Whole grain bread has a lower value of 7. A glass of Coca-Cola or Fanta scores around 20, unsweetened orange juice 12, while tomato juice is only 4. A 30-gram serving of muesli, which is just 2 tablespoons, scores 16, while corn flakes score higher at 23. Whole grain muesli is lower at 12. Among cereals, white rice is particularly bad for those looking to avoid weight gain, with a 150-gram serving having a glycemic load of 43, whereas the same serving of corn is just 20. Conversely, the same amount of brown rice has a score of 16, and quinoa scores 13. A cup of homemade oatmeal scores 13, while instant oatmeal scores 30. Interestingly, rice cakes have a higher glycemic load than vanilla waffles. Clearly, white rice, corn flakes, and muesli should be your last choice if you're worried about weight gain and diabetes. Continuing, a cup of milk has a low value of 4 to 5, and a scoop of ice cream scores between 3 and 6, depending on the type and added sugar. A 120-gram serving of fresh fruit generally scores between 3 and 6, although ripe bananas can score around 16. Now, the category with the undeniably lowest values is seeds and nuts. Cashews, peanuts, almonds, hazelnuts, walnuts, pumpkin seeds, and sunflower seeds, in 50-gram servings, all have values less than 3. Additionally, legumes such as beans, lentils, green beans, and peas have relatively low glycemic load values. Conversely, a 180-gram serving of macaroni and cheese scores a staggering 32, and overcooked spaghetti 26. Among snacks, popcorn is the most innocent with a score of 6, whereas sugary candies and chocolate are the worst choices. A 150-gram serving of baked potato scores 33, while the same amount of boiled potato is somewhat lower at 21. After burdening you with all these numbers, which I dislike and don't recommend anyone to obsess over in terms of looking at tables, counting calories, or calculating indexes, let's sum up the main points of this discussion in a few sentences. So, what food causes us to gain weight and become ill? Foods and drinks rich in simple carbohydrates or sugars, sodas, all sugary desserts, processed foods lacking in dietary fiber, since fiber slows down sugar absorption in the intestines, such as white bread and pastas, baked potatoes, white rice, cooked corn, products with added sugar syrup, like muesli and corn flakes, and dried fruits. On the other hand, some foods cause less weight gain relative to their calorie content, including nuts, legumes, all kinds of vegetables, except potatoes, especially raw vegetables and salads, all kinds of fruit, except bananas and in excessive quantities, and all animal products such as meat, fish, dairy, and eggs. Finally, I want to say that keto diets, which exclude carbohydrates, are more successful than others, not just because they involve low-calorie intake, but primarily because they are based on foods that do not cause large fluctuations in blood sugar levels. Of course, going too far in keto direction and completely excluding carbohydrates has its consequences, one of the worst being the breakdown of body tissues, as well as a lack of dietary fibers and phytochemicals. I will address these issues in the following videos. Thank you for your attention. If you enjoyed this video, please click the like and share buttons, and consider subscribing for notifications on more videos.